There are numerous causes of knee pain, but the most common factor in osteoarthritis, or the most common symptom, is weight-bearing pain. When you walk, it hurts. Osteoarthritis is basically when cartilage on the end of the bone either becomes too thin or wears off completely. So people will tell you it feels like bone rubbing on bone. That's exactly what's happening. The bone has the nerve ending, so the joint becomes painful and people lose their ability to bear weight. Patients can initially experience difficulty moving their joint or stiffness in their joint, which can progress loss of motion in their joint. Finally, the pain becomes so bad that they can only walk maybe a block or two, and pain that wakens them from sleep at night. Patients come in asking me when it's time to have a joint replacement, and I basically tell them that when your quality of life suffers to a point where you don't want to put up with the pain or miss out on the activities that make you whole, then it's time to consider a joint replacement. The typical age range for joint replacement candidates actually dropping in the United States is under 65 years of age. We're seeing younger and younger people getting joint replacements because they're not willing to give up their quality of life. If you've exhausted all of the conservative treatment and your life quality is such that you can't put up with it anymore, that you are a candidate for a joint replacement. It's a safe procedure. It is a common procedure done in the United States, and the technology has gotten much better to help us achieve placing them into the knee joint better. Navio is a robotic computer system. It allows us to change the variables interoperatively, so it maximizes the position of the joint in the best possible place for the patient. We were the first center in Southern California to actually have one of those units. So as surgeons, we're always trying to improve the way we do things. And I think the Navio system allows me to put a total knee in a better position, which in the long term will benefit my patients. I've been part of the surgery center staff for about 9 years now and have done thousands of procedures at the surgery center. We've now done 1,000 outpatient total joints without a single infection. Every one of my patients who's had a total knee at the outpatient surgery center has had nothing but good things to say about the center itself, the staff, the process, how they felt like they were really being cared for in a concierge type fashion. Most people look at it as a much more friendly environment. The risk of an infection is much lower in the outpatient surgery center environment, and the costs are lower for the patient.